side effect. And when he returned to our apartment, I was putting on my sandals and I fell. I felt my body fall like an elevator shaft.
Yes.
My body, or my thoughts, were completely severed from my body from that point on. And I lost my ability to speak. So he drove me to the hospital.
Yes.
And from there, I took a CAT scan, and they wheeled me directly to the ICU unit.
What were you thinking during all of that? I mean, you're only 21 years old.
Yeah, well, I wasn't thinking anything. I was really confused and lost my whole identity because of lack of speech.
Yes.
And paralysis, I didn't really know I couldn't move. But in my fall, I just had the will to pick my body up, but couldn't. But I didn't know that I couldn't move.
You didn't know you'd had a stroke.
Yeah, exactly.
And so when were you told?
2 weeks after.
2 weeks after?
My parents were told the day that I had the stroke. But I watched the nurses look at me pitifully. I watched the doctors look at me, you know, that way too. And the people in white, I call them,
Yes.
were my rescuers and then prisoners. They did everything to me, for me too. They bathed me, fed me, took care of every need. So that I didn't know I couldn't move until 2 weeks later. And the thing is, the day after it happened, my mother came because she lived 5 hours away in Pennsylvania.
Yes.
So she came to Ithaca, New York, and she was the first person to hold me, to cuddle me, to touch me.
Wow.
And that whole time of being prodded on machines and being carted away.
Sure.
So that was my one instant of connection. And I knew I wasn't lost in a bed.
Yes.
I knew I was connected to someone.
Now, you said it was 2 weeks before you were told that you had a stroke. What did you think when they told you that?
Well, I didn't know what a stroke was.
Well, at 21, it's not on the top of your list of things to know about. You know?
I was vital and healthy.
Sure.
And the impact of being normal and then suddenly being disabled was the worst, was a disaster. I was one of them now.
Yes. Sure.
And I didn't have a handbook. So I didn't know what to think. They were words, which didn't mean anything to me because I was having trouble with my thoughts too.
Yeah, that's right. That's all part of it, as well as your physical disability. And what type of physical disability did you experience?
Well, my right side was completely paralyzed from head to toe, and I was right-handed.
Ugh.
I had to learn how to do everything with my left hand, and still it's paralyzed, my right arm plus my right hand.
Okay.
So I had to write with my left hand. I had to put on makeup with my left hand. I had to learn how to pick up silverware and do everything with my left hand.
And how long did it take you to get to a point where you were sufficient, you could do it yourself?
Well, I drove up to Ithaca a year or 5 months later.
You did?
With limp and aphasic.
Ah.
And just to belong there again.
Yes.
So I wasn't all the way better.
But you wanted to be.
Yes.
In Ithaca.
And I was sick of hospitals and therapy and death and sickness.
Yes, yes. You wanted to get back into the world of being healthy.
I just wanted to live normally again.
Sure.
And that's my story.
How well have you been able to accomplish that?
Well, that was 23 years ago. And I have since completed 2 master's degrees. And I'm now Chief of Staff at the National Stroke and Quality of Life Institute and helping other stroke survivors and their families deal with stroke.
Well, that speaks for itself. It sounds like you've done extremely well.
Yes. This brought me, my whole life's work is this.
Yeah, yeah.
And this brought me to a caring and compassionate point in my life to deal with my heart.
Yes, yes. Well, you know, it's not unusual, and I certainly relate to what you're saying. Having been in a very similar situation years ago when I was a young medical student, it does change you in a very profound way, and it does give you a different perspective on life and on being in touch with those special things inside, the things that we all take for granted that are so important. Now, the book, Return to Ithaca, it was actually a journal. Is that right? You just you kept a journal.
It started as a journal. It was started the first month after I had the stroke, even though I couldn't speak. And it was filled with misspellings and filled with poor grammar. I had to learn the inner me. I had to, that's all I had. I lost my identity and lost the I in me of the sentence. So I had to hear myself speak. And I was living a life of depression too. I had to get myself out of the depression into optimism, into yes, I'm recovering by my journal. And
that's what your book is. It's essentially your writings through your recovery.
Yes, it's essentially my writings through my recovery, and it's about being able to pick yourself up and being able to take risks. And the world is filled with hope. Being able to adapt to any circumstance and to have full quality of life.
What is the message that you want to deliver to our viewers, and through your book as well? What is the essence of your experience that you want us to all know and learn from you and what you've been through?
Well, there's plenty of hope left. We deal with such a negative society. And that when a stroke occurs or any disability, we're thrust into a negative role of disabled. But there is plenty of experience on both sides. And the survivor, the caregiver, the professional must learn to learn from each other. And be compassionate and patient with each other.
Absolutely. Now, did you get married? What happened with after your stroke? I know you were engaged.
I was engaged. That didn't work out. I lost my fiancé. I lost my job. And I lost everything. But last year I got married.
Well, congratulations. That's wonderful.
Thank you. So my life is full.
Yes. And what do you do with your foundation? I know that you're chief of staff. Tell me, what do your duties include?
Well, we rely on the psychosocial aspects of post-stroke. Teaching professionals, stroke survivors and caregivers all about the psychosocial aspects. Plus, I deal with taking a post-stroke survivor 2 years out of the hospital experience, after the hospital, and teaching him or her adaptive techniques to begin to be independent and learn the quality of life again.
What would you say to those folks that are, I'm sure, watching, who are going through rehabilitation now with a stroke? I've had many callers that have been so frustrated because their progress has been so slow. They don't feel as if the people that are working with them understand how frustrated they are and how anxious they are to get back to normal. Their family don't understand. They don't quite understand what it's like for them. What would you say to them?
Well, a support group is so important. I think that having the support of others got me out of the dilemma of depression. I think that whether it's a professional or someone, just reach out and listen and speak to each other.
It makes such a difference. Barbara Newborn, wonderful, wonderful book. I hope we can pop it back up on the screen. We do want to show this book. It is generally available now in bookstores?
Yes, or you can order it.
Oh, great. Okay, we're going to put a number up later in the show for those folks that would like to obtain the book, Return to Ithaca. Fascinating story. Congratulations. You are marvelous.
Thank you.
Okay, we'll be back in just a moment and we'll talk about the treatment of strokes.